When you come into your dental visit with your hygienist, there are many tools that we use to diagnose periodontal disease. The first tool that we use when diagnosing periodontal disease is your medical history. Lots of risk factors for this disease can be seen just with what has happened to you in the past. For example, if you have a history of smoking or you currently smoke, you are at a greater risk to develop periodontal disease. Also, if you're diabetic, you also are at a greater risk to develop this disease. We also find too that patients who have infrequent visits to come in for professional dental cleaning and people that have poor home care, such as brushing and flossing irregularly, are also more prone to develop this disease. The biggest risk factor of all, unfortunately, is the one that we can't control, our family history. So if you know that someone in your family has had this disease, it's very important to have this screening done regularly. The second tool that we use to diagnose periodontal disease is an examination that we do at least once a year when you come in to see your hygienist. When we do this exam, we use this tool that looks just like a ruler to measure the pockets or the spaces between your teeth where the bacteria can live. The deeper the pocket or the higher the number that the hygienist calls out, the more prone you are to have bacteria living in this space that can cause your gums to bleed. Sometimes patients experience tenderness or sensitivity during this exam, and that's because the gums are irritated, swollen, and inflamed from the bacteria that's causing the infection. The third tool that we use to diagnose periodontal disease are x-rays. Not only does the dentist use these x-rays to check to see if you have cavities, but as hygienists, we use it to check your bone level. As you can see in this picture, on a healthy tooth, the bone is nice and high and it's attached tightly to the gums and to the tooth. In this picture here, you can see how there's more of a space where the gums have pulled away, but also the bone has started to drop downward. So by using x-rays, we're able to check the bone height and to see if that infection has also spread into the bone. Fortunately, by coming in regularly and seeing your dental team, we are able to help treat periodontal disease and maintain it for the life of your teeth.